Well, let's put a disclaimer here. I'm not a medical professional. We are not an expert in insurance or anything. We're just talking from experiences, from what we observe, and we're not taking sides with whether it's public health insurance or private insurance. We are just talking in general terms what student needs to know. If you are a student in
My name is Princess Briggs. Welcome to Caliversity, the channel aimed at helping international students and those planning on studying abroad. Today I have a very lovely and special guest. Please introduce yourself, sir.
My name is Amoye and I'm a student in Poland.
Good. So today we're going to be talking about a very, very important topic that a lot of people do not talk about, which is the international health insurance. Health insurance is the cover of the cost of medical care.
Yes. Yeah. So it's just the amount you pay for your medical services.
Yeah. The thing I've noticed about a lot of students is they often think that travel insurance and health insurance are the same. Well,
they're not.
They have a little bit of similarities in them, but the thing about travel insurance is it's used while you're on the plane. That is it's the cost to cover, your cancellation, like your plane cancellation, or for your personal belongings, and also for emergency while you're on the plane. And maybe when you go for holidays, and it can be used for a very short period of time when you are there. But a health insurance covers a lot of things. So
yeah, it has to do with your medical insurance, has to do with the basic medical care you receive while you're living in a country whether you study or you work or you do a variety of things. So other than your holidays, because your holidays is assumed to be a short period of time, but your health insurance covers you for a longer period of time.
Yeah.
So basically, since we're in Poland and we would like to talk about the types of medical insurance in the Polish healthcare. So we have the private one and the public one. But first of all, let me point out that everyone in Poland is mandated to have health insurance, and especially for students, the public health insurance and the private health insurance. So what is the public health insurance? The public health insurance has to do with the publicly funded insurance scheme. So let me tell you what it is called in Poland. In different countries, there are different names given to their own insurance. But in Poland, it is called Narodowy Fundusz Zdrowia, NFZ. I'll repeat, NFZ. Narodowy Fundusz Zdrowia. I hope I pronounce it very well. I hope my Polish is good enough. Okay, so in English, the meaning of this is called National Health Fund. National Health Fund. So this is what it means in English. So it is a publicly funded health insurance. So this is what it means in Poland. And then for the private one, we would not mention any name of any private insurance here on this video because we are not sponsored or advertising for anyone. So but there are at least a wide range of private insurance scheme in Poland. You can ask your friends, you can ask your employer, you can ask anyone to tell you these names. We can provide you with a link that would take you there to that place. But on this channel, there will be a link in this video in the description. So basically, these are the different types of health insurance in Poland. So the publicly funded one and the privately funded health insurance. I mentioned that it is Narodowy Fundusz Zdrowia. It is the insurance scheme that is publicly funded and also connected with the social security institutions in Poland. So all taxpayers, every system of public funds goes into the scheme for everyone who has the policy in the scheme to have proper medical attention. So in Poland, you can have access to a wide range of medical care. For example, you can have access to the clinics, the public clinics, to the hospitals, to emergency, and the emergency number you can call in Poland is 112 or 999. So you can either call these two numbers and then you can receive medical attention if you have NFZ. So for all students, like I mentioned before, it is mandatory that you should have whether a private insurance or a public insurance. I hope this has clarified this issue of NFZ. So NFZ is the publicly funded insurance that you have access to that covers a wide range of medical care and facilities. And also, just to mention that when you have NFZ, there are a list of drugs that are refunded. So, for example, you can have, if you have some kind of special needs or special medical ailment or disease or something like this, and then if this drug that you buy is among the list of refunded drugs in NFZ, you pay less for it if you have NFZ insurance. So you pay less. So this is what you call this refunded. So these are the benefits of having NFZ insurance in Poland. Like I mentioned before, you have access to various medical facilities, and first of all, having health insurance goes in line with the principles of your right and access to medical attention. So this is not just in Poland, but generally from the World Health Organization, it is part of your right to medical care. So when you are buying your health insurance, no one is asking you for you to bring your residence card or your visa or anything. They would give you this insurance based on you as a person, but you have a means of identifying yourself, maybe your passport or anything. They are not bothered about your residency or anything. So if you have health insurance, you can go and seek medical attention within 30 days period without having any hindrances from anyone. No one will ask you to pay for the cost of having treatment for anything or any ailment, because health is wealth. Health is you need to live and have the right to medical attention, medical care, medical treatment. So this is one of the benefits. These are one of the benefits of having health insurance. And also, like I mentioned, you can seek medical attention whether in a private hospital with those doctors who have agreement or who are registered under the NFZ in Poland. So there are some hospitals where you go to that are privately owned, but they have the symbol of NFZ on their logo or on their buildings, and you can easily recognize that some doctors in that place have agreement or are registered under the NFZ scheme. So it allows you, who is the holder of this insurance scheme, to seek medical attention or to get treatment in that hospital, and as well as a different different hospitals in Poland. You can go anywhere within the Polish territory, whether you're in Warsaw or in another city. You can visit any public or any hospital with the NFZ logo. We'll put a link below, and then you'll be able to see the logo of how NFZ looks like. But because we're not promoting any organization or any company, we will not put any design or anything on this video, so we don't go against any policy. So basically, you can see any doctor. You have right to emergency, ambulances, clinics, first aid treatment, regardless of your status, regardless of whether you're resident in this country or not, but you have the right to medical attention in this policy. So this is one of the benefits of having health insurance. And also, even if you're using your health insurance for to renew your residence card to show that you have this policy and you're not going to constitute a burden to the Polish healthcare, you need also to see that this insurance you're providing is valid for immigration purposes, because the immigration wants to know if you are properly insured. So as a student, you need to make it as a proof whether for 6 months, at least for 6 months, you need to be insured for 6 months. If you cannot buy the 1-year policy, you can buy 6 months, and then you'll be able to show the immigration office that you have health insurance in Poland. So these are the benefits of having health insurance in Poland. So for me, I think from the beginning when I came, I've always used the public health insurance because it gives me a wide range of benefits, so that I can use the private hospitals in case of emergency or any urgency that I need to seek medical attention, and then the public ones anytime I'm able to see a specialist or any special needs that I need to see a doctor for.
That's good. Actually, I remember this thing that happened to me last year summer. I was supposed to get a health insurance to renew my residence card, and then I really did not know much. I had, friends that were also doing it the same way that, like, we all did not know much. So I went to some of my friends and they were like, just get the cheapest insurance, blah blah, no one cares, just get the cheapest insurance and give it to the immigration, that's all. And some of them were like, how many times have you gotten sick since you got to Poland? I was like, I've never gotten sick. So, and there was this company that had like a promotion during that period of time. It was quite cheap for my age then, and I got the insurance without asking any question. Like, I did not know the policies. I did not know the hospital that I was supposed to go to. What I had in my head was, let me just get the health insurance and give it to the immigration. That was all. And when it actually like got to me was the time that I had the skin reaction, and I had to visit the doctor because my whole face, my whole body was swollen. I did not know the hospital to go to. That was where I was confused. Like, I was confused. I did not know the hospital to go to. I did not know anything about it. So I had to like go to the company where I got the insurance, and I asked questions. And they were like, go to any hospital, And I was like, well, what do you mean by go to any hospital? And they were like, well, go to the hospital, pay, and then get the invoice. Then we'll refund. That is, if it's refundable. Like, if,
your health condition is refundable.
Yes, my health insurance is refundable, so I do not have any and I was like, okay, what about for consultation? Like, what if I just want to ask just the doctor questions? They were like, well, you have to pay for that. And the thing that actually got to me was the amount that I paid for consultation was even higher than what I paid for the
total package of the insurance policy
for 1 year. And I was like, oh my god, like, what if I had no money at that particular time to pay for my health and pay for consultation? What would have happened to me? So I think it's very, very useful if students, not just like everyone, ask questions. Even if like the person does not like know English, just ask them, like, use Google Translate and just like, tell me your policies, tell me everything I need to know, because it's very useful. That's what a lot of people don't like. Today you might be like, oh, since I got here I've not fallen sick, maybe I've stayed here for 3 years, nothing has happened to me. No one knows tomorrow. So it's better for you to like take the right steps and just be careful with your health. Do not take this as any other thing. So do you have more things?
Yes, I remember just now that while you were talking, also, one of the benefits of having the health insurance is that apart from the basic health needs that you have, visiting a general practitioner, with the public health insurance, I'm saying this based on the experience of what I've done. We have what we call preventive health care. So, and if you have the health insurance, the public health insurance, or generally health insurance, having the access to preventive medical treatment in Poland gives you a whole lot of benefits. It's not until when you're sick or when you have a disease or you have an ailment that you need to see the doctor. There are some things hidden in our body that you just need to seek medical advice or medical consultation. And when you have the public health insurance or any health insurance at all, I advise that you use it, because you need to check your internal organs, things you cannot see with your own eyes. Even if you just notice something, or you observe some changes in your body system, or even if you have flu, you understand, apart from going to the pharmacy and things like that, just imbibe in the habit of preventive medicine, preventive health care, because prevention is better than cure.
Sure.
And what you cannot see with your own eyes, the doctors, the medical professionals, they're able to see it and check you and examine you thoroughly. I can remember a time that I just wanted, apart from using paracetamol or aspirin, I wanted to just see the doctor and just to ask that I can't sleep, So then they after checking my body, they check everything in my system. I discovered that I was having a lot of stressful moments. So, and it was at that time they were able to tell me I need to take things easy, I need to sleep well, I need to eat well. Apart from your studies and things that you're doing so well, you also need to have this habit or behavior of preventive medicine. It's really, really good, because not until you have something, or even if you have the health insurance or you don't have health insurance, go to the doctor, ask questions. They will tell you, these are the things that you need to understand. You might not be falling sick, you might not have symptoms. There are some diseases that you don't have symptoms for, but once they hook you down and they weigh you down, then you don't know whether you have high cholesterol or high blood sugar or any other kind of diseases if you've not gone to test. Whether you're coming from your home country and you've never checked, or you're using a particular drugs and here you don't know how to get it, but you need a first consultation with the doctor, to be able to tell you all these things. And when you have the health insurance, you can knock on any door in the hospital, they will attend to you, I tell you. So it's better to have this this kind of health behavior to help yourself in the country you're living. So I think for students it's mandatory you have health insurance, because you might be having exams, stress and things like that. And even if it's just to talk to the doctor and to relieve you of some emotions or things like that, it's better you have health insurance with your studies. And you're having a busy moment, you don't sleep well, you're overreading, you're overworking yourself, you need to see a doctor. Just to ask questions sometimes is enough. So yeah.
So thank you very much.
You're welcome. It's my pleasure. If you have questions or anything, feel free to. Well, let's put a disclaimer here. I'm not a medical professional. We are not an expert in insurance or anything. We're just talking from experiences, from what we observe, and we're not taking sides with whether it's public health insurance or private insurance. We are just talking in general terms, what student needs to know. If you are a student in Poland coming for the first time, I advise get medical insurance. Ask your university, ask your school, ask your friends, I want to get health insurance. Otherwise, you forget, you have a lot of things on your mind and you won't remember until when you need it, and then it's too late.
Yeah. So thank you so much for staying with us. Thank you so much for watching this video. If you like this video, please literally like the
Press
video.
the like.
And if you have questions, please comment below. I will
provide
answer
some
your questions.
answers. Yeah.
Thank you so much for sharing your knowledge with us today.
It's my pleasure. You're always welcome. If you have any other questions, you can direct it to Princess and I will get this information. Yeah.
Okay, till next time.
Bye bye.